Let's start by our first topic for today, which is rheumatoid arthritis. Rheumatoid arthritis is a very important topic. At the same time, it gets confused with osteoarthritis. Why do you think rheumatoid arthritis gets confused with osteoarthritis? Why do you think anybody thinks why rheumatoid arthritis gets confused with osteoarthritis, and how to differentiate between them both? If you know, please tell me. If you know, what is the difference between rheumatoid arthritis and osteoarthritis? Please tell me. What's the difference? How can you spot? Yeah. Sorry, Dr. Yasser. Yes, please.
Rheumatoid is mostly can present in young age.
Okay, but still can present in older age groups as well. Okay. What else? Stiffness duration. Okay. But what is one of the commonest, one of the most characteristics that can differentiate between rheumatoid arthritis and osteoarthritis?
Rheumatoid is usually in multiple joints. Osteoarthritis is usually not always in one joint.
Perfect. Thank you so much, Dr. Sarah. Mainly osteoarthritis is unilateral. Osteoarthritis mainly is unilateral, can happen mainly on one side, and it is a monoarthritis, meaning that a patient who's having osteoarthritis, they could get pain in one knee, arthritis in one knee, redness, swelling in one knee. It doesn't necessarily mean that they should be getting on the other side. Patient can get one hip joint arthritis. Okay, so it is mainly monoarthritis. It happens mainly on one side. This is mainly the difference between osteoarthritis and rheumatoid arthritis. In addition to that, stiffness duration. Which one is more stiff? Is it rheumatoid arthritis or osteoarthritis? Which one is more stiff? Which one lasts longer? Rheumatoid arthritis or osteoarthritis, do you think? Yes, rheumatoid arthritis lasts longer, takes more time until stiffness goes away. Okay. What is rheumatoid arthritis? Again, if you follow us, if you attend our sessions, you know, we are very, very organized, very structured. Whenever we have any medical condition, we know how to explain it in a perfect way. If you follow our structure, you'll never get lost. So what is rheumatoid arthritis? Can anybody explain it? What is rheumatoid arthritis? Follow our structure again. Okay. Is rheumatoid arthritis a long-term condition or is it a short-term condition, do you think? Rheumatoid arthritis. Yes, please.
Long-term condition.
Is it it is a long-term condition? Is it a common condition or is it an uncommon condition or is it a fairly common condition?
Common.
Common condition. What normally happens in rheumatoid arthritis? What is rheumatoid arthritis in origin? What is rheumatoid arthritis in origin?
Autoimmune.
Okay, yes. Yep. So our body defensive mechanism attacks our joints mistakenly. Then next step is going to be, is this condition treatable, untreatable? Can it be brought under control? Is rheumatoid arthritis treatable or it can be brought under control by specific medications.
Can be not under control.
By specific medications such as DMARDs and things. Okay, this is how to explain rheumatoid arthritis. It is very important to train yourself on various medical conditions and how to explain them effectively. This is very important. It saves your time in your exam and also your time in your day-to-day practice with patients. Okay, now rheumatoid arthritis, what your questions should be. So presenting complaint, any joint pain, any swelling, any stiffness. A general rule in MSK, whenever you're dealing with any patient with MSK, always ask this triad. Any joint pain, any swelling, any stiffness. We've mentioned, is it on one side or is it on both sides? If the patient is having stiffness, how long does it take until stiffness goes away? Any generalized fatigue, any generalized malaise, because rheumatoid arthritis, remember, is an autoimmune disease and can also cause illness, can cause what? Malaise, can cause fatigue, can cause tiredness. Okay, now, differential diagnosis. This is your second part in your bubble. Remember, we've mentioned about bubbles before. So this bubble is presented complaint, differential diagnoses, and red flags. And this is how you will sound very structured. Don't float between bubbles, as we've mentioned before. Any rash on the skin, any nail ridges as a differential diagnosis. What does that sound of? Rash on the skin, nail ridges.
Psoriatic arthritis?
Yes, perfect. Psoriatic arthritis, perfect. Any traumas, any injuries. Another rule in MSK, trauma, injury is always very important to ask about in your differentials. Any trauma, any injury can cause pain, in the joint. Red flags, any rapidly worsening joint pain or swelling, and fever, any chills. So why is that? What does it mean? Fever, chills, rapidly worsening pain or swelling. What does that mean?
Septic arthritis.
Yes, perfect. Thank you so much. Are you able to move the joint? This is very important. Any sudden loss of function in the joint. Any weight loss or any night sweats. What does that mean? Weight loss, night sweats.
Malignancy.
Malignancy, cancer. Yes, thank you so much. Home, any adaptation needed at home for mobility or self-care for patients with rheumatoid arthritis, any help available with your daily tasks or home situation. How about home situation? This is very important. Occupation, what do you do for a living? What do you do for a living? Does your work involve repetitive movement, joint strain, heavy lifting? Why this is important? Because if the patient is struggling, it is very important to offer them help. What kind of other jobs that are very involved in this as well? What are the kinds of other jobs? Which job, which is a very, very common presentation job, patient comes to you telling you, doctor, I cannot really function because of my job. I cannot really help because of my job. Typing, yes. Using hands, yes. So it is secretaries, it is receptionists. Actually, in your practice, some receptionists, they are always on the go, using their hands a lot, booking patients, always using hands. So they always struggle. They get swelling in hands, swelling in fingers. So this is very important to bear in mind. How to help them, how to help secretaries, how to help receptionists in particular. Anybody knows how to help receptionists with their pain in hands? What would you offer? Remember, you are a GP, you are a tailor. You are a problem solver. You are a consultant. You are looking at the wider picture. You don't treat disease. You treat the patient as a whole. How can you help somebody who uses hands for typing? Yes, things like Alexacom, things like, Heidi. I'm not sure if you heard about Heidi. Okay, so it's a kind of an internet-based tool which actually listens to what you're saying and can actually interpret that into typing instead. Okay, what else? What can they wear whilst they are typing using keyboards? Anybody knows? What can they do? Okay, braces, yeah. Okay, these can actually help supporting the wrists. As well, there are some mouses nowadays as well, like some mouses that can be bought, and they are very, very good actually relieving pressure on hands as well whenever they are using them. So there are lots and lots of things, lots and lots of options you can give your patient. Now, diet, exercise, smoking, alcohol, all of these are very important. Know what the patient has tried. Has the patient tried anything to help with the symptoms, any specific exercises, any specific medication? Very important to ask about family history of rheumatoid arthritis and any autoimmune diseases. All of these are very important. Remember, any autoimmune disease can come associated with other autoimmune diseases. And this is why it's very important, if a patient is having an autoimmune disease or you do suspect they have, you need to ask about some other autoimmune diseases, specifically if they do run in family. Okay, so all of these are very important. Now, rheumatoid arthritis, what to do? What to do? Now, a general rule, another general rule. All of the MSK, again, listen to me carefully, please. All of the MSK conditions that need blood tests to be done, you should always consider ESR and CRP. Again, any medical condition that requires, not all MSK conditions require blood tests. And I'm sure you're all aware about that, but there are some that do require blood tests to be done. If they do, you always need to consider ESR and CRP. Okay, now rheumatoid arthritis, how would you get a flavor? How would you confirm the diagnosis of rheumatoid arthritis? How would you confirm the diagnosis of rheumatoid arthritis? This is a part of your management. You need to know how to confirm diagnosis of rheumatoid arthritis. What to do? What are the blood tests? Actually, they've been mentioned here in front of you. Rheumatoid factor. Rheumatoid factor, is it alone enough, or shall we also include anti-CCP? Anti-CCP is very, very diagnostic for rheumatoid arthritis. You need always to consider it with rheumatoid factor. If you are suspecting rheumatoid arthritis, anti-CCP is very important. Rheumatoid factor is very important. ESR, CRP, use and ease. Use and ease are very important. Now, I'd like to ask you this question, and I would like you to give me a clear answer. Rheumatoid arthritis is mainly a specialist disease. It's mainly a specialist management. You will be referring rheumatoid arthritis to the specialist. Okay, and we are going to talk about why you're going to do this. Doing blood tests, should it delay your referral or not? So, should you be doing anti-CCP, rheumatoid factor, and then when it comes back, then you wait for it and then refer the patient to specialist, or shall you refer the patient now, and while it's doing this referral, you do the blood test.
Refer now.
Refer now. Do the blood test at the same time. Okay? I mean, actually, even though if you are suspecting a patient with rheumatoid arthritis, specifically younger age groups, you can still refer the patient without doing bloods. However, bloods are very important because bloods will help the specialist know whether or not they are dealing with rheumatoid arthritis. It's actually very good for the patient. Okay, perfect. You should be referring the specialist, into the specialist. And why is that? Is actually because the specialist can start the DMARDs. What are the DMARDs? They are specific biological medications that can actually help bringing rheumatoid arthritis under control. There is no treatment for rheumatoid arthritis. It can be brought under control by these specific medication. I'd like to ask you a question which is very important. So imagine a patient coming to you telling you, doctor, I am suspecting that I'm having rheumatoid arthritis. And yes, you agree based on symptoms. Now you decide to refer the patient, and the patient started to get very anxious, started to cry in front of you. Ask them, what's going on? What's happening, doctor? My mom, my auntie had rheumatoid arthritis. What happened was she was started on biological treatment. She was started on methotrexate. And she started getting hair loss. She started getting liver damage. She also started getting problems with her breathing. I don't want that to happen to me, doctor. I am not keen to start this medication. What should your answer be? I would like somebody to tell me, what are you gonna do? If a patient coming to you telling you, doctor, I have a bad experience with that in my family. My auntie, my mom, my grandma had this medication and they suffered side effects. How can you deal with that? This is very important. This is very important. And this comes under your profession as a what? This comes under your profession as a what? Anybody knows? What's your profession now? Not problem solver. No. We mentioned before that a GP should be 3 professions apart from being a GP. First one is what? Is tailor. Second one is a problem solver. But the third one is what? Is a good salesman. Or a woman, of course. Salesman or a woman. How would you convince the patient that this medication can still help them? And even though there are side effects, so what? Can anybody tell me what to do in that situation? You can get exposed to this situation, please. Dr. Roni, please.
Yeah, thank you very much. I understand your concern, and certainly it is valid worries what's going through your mind. However, to reassure you, we'll be monitoring, we're doing regular checkups on you and monitoring bloods regularly, so we can detect any changes earlier and to avoid getting any complication.
Okay, perfect. This is a good answer. Yeah, thank you so much, Dr. Roni. There is also another thing. A side effect of any medication doesn't mean that the patient should get this side effect. Any medication in the world has side effects. Any medication, even paracetamol, has side effects. Mentioning side effects of a medication doesn't still mean that you should be getting these side effects, but you could get side effects. Okay, so this is very important to bear in your mind. Side effects doesn't necessarily mean that they should happen, but they can happen. Okay, if your mom, if your auntie had side effects of this medication, this doesn't still mean that you will be getting these side effects. This is first of all Second thing, there are now other new versions of medications that are less side effective, and the specialist can consider that to you as well. Doesn't necessarily mean that they should be having only methotrexate. There are other medications that can be considered as well. Even though if you've been started on methotrexate, this is absolutely fine. If you start showing any side effects, we are pretty sure that there are close monitoring, as you mentioned, Dr. Rumi. And if any problem happens, we make sure we monitor it on time. Be a good salesman or a saleswoman, salesperson. Okay? This is very important. Side effects do not mean that they are gonna happen. Side effects do not mean they are gonna happen. So put that into your mind. Now, if you to refer this patient who's telling you, doctor, I have pain, I have swelling in my hand joints, how long should it take until then being seen by the specialist? Ideally, should be how long? 3 days. Yes, perfect. 3 days. So what is the criteria for 3 working days by the specialist to be seen? First one is small joints in hands or feet are affected. Small joint in hands. Remember, hand, which is one of the commonest presentations of rheumatoid arthritis. More than one joint affected, which is also very common to happen. Patient doesn't tell you, doctor, I have swelling in my finger. No, in my hand fingers. Of course, if there has been a delay, if the patient telling you, doctor, it's been ongoing for quite a while now as well. So yes, at that point, the patient needs to be seen, ideally during 3 days' time. This is very important. So it's always 3 days' time if the patient is fulfilling these criteria. Now, what to do as well? Now, we haven't finished this problem because the patient is coming to you, telling you, doctor, I have pain, I have swelling, I have stiffness. How to help with pain, how to help with swelling, how to help with stiffness as a general rule. Now, pain, simple painkiller, like what? NSAIDs. But NSAIDs, you need to be aware about 2 major problems with NSAIDs. What is the first one? What is the first one? When to take caution with NSAIDs? Yes, okay, gastritis. But what are the cautions against NSAIDs? First caution is asthma. If a patient is asthmatic, you need to be very cautious with NSAIDs. Second one is, okay, blood thinner, no, okay. But one of the main ones, kidney disease, CKD, you need to take caution. Okay, specifically if the patient is an elderly patient, so always think about this. Now, if a patient is showing any of these, what would you offer? Okay, PPI for gastritis, if the patient is suspected to have gastritis. Things like ibuprofen, naproxen, you can still offer, yes, a PPI with them. This is absolutely fine. How about if the patient is having contraindications to NSAIDs, alternative painkillers such as paracetamol, such as topical ibuprofen? Topical ibuprofen can still be considered even though if the patient is having a kidney disease. If the patient is having asthma, I would rather not prescribe NSAIDs at all. Okay, perfect. What to do? Yeah, topical, yes, you can still consider that. So mainly, when to use topical. Anybody knows there are 2 places when to apply topical NSAIDs, and they are in the guidelines. Okay, in osteoarthritis, yes. Where? First one is in knee. Second one is in hands as well. Can still use that. You can still use that in hands. Right, work, support, amended duties, occupational health, we've mentioned about that. So you offer some help and support, as we've mentioned, and also another form of help and support is what is amended duties. First return is very, very severe. You can provide that to the patient. You can speak to the occupational health and can do workplace-based assessment, and they can either change the nature of their work or they can provide them aids during their work. Remember, Q-risk score is very important in rheumatoid arthritis. Q-risk score needs to be done in patients with rheumatoid arthritis. You have attended our sessions before. We've mentioned about how to explain Q-risk score in a very good way. Again, all of the MSK conditions, there are patient information leaflets. Patient information leaflets. You can always consider that, yes, rheumatoid arthritis can actually increase the risk of cardiovascular diseases. So that's why we need to do a Q-risk score. What's one of the commonest patient information leaflets are very, very well known, things like versus arthritis. There are local ones as well. Okay, so in our area, it's called TIMS, T-I-M-S. But don't worry too much about that. So patient information leaflets, actually, if you do have time, of course, safety netting should be done for this patient. Safety netting against one of the most important things, which is septic arthritis. Yes, septic arthritis. Septic arthritis, you need also to be a very good GP